leg and bad leg. Okay? So we'll say that Pranav's having problems with his right leg. We're going to come over here. Just like this, you're going to start here. Whatever the bone is for your motion palpation, right? Then you're going to come around to the good side. Now, you don't have to do the whole motion palpation scheme, only the bone that we're interested in. So if it's a talus, you'll motion it like this, right? If it's anterior and medial, he'll have some problems this way. If it's anterolateral, some problems pushing it back here. If it's just anterior. If it's gone posterior, you'll feel a little drag when it's coming out this way. Okay? Everybody got that? Then you're going to come over here, find the navicular tubercle. You're going to stabilize the talus, and you're going to grab the navicular, and you're just going to move it up and down. That's all you're going to do. Okay? Everybody got that? Then you're going to come down, stabilize the navicular. If you're doing the first cuneiform, and you're going to move it up and down like this. You can just do it like this on the navicular if you want. This, I think, helps you to understand more what you're doing, but either way, I'll accept it. To do the second cuneiform, you're going to come down, you're going to follow this down. Make sure you know your landmark. You're going to be just distal to that. You're going to grab the second cuneiform, then the third.
You're
just
still
move it up and down.
navicular.
Still stabilizing the navicular and the cuboid in this first row. Okay. To do the proximal fifth metatarsal head, you got to stabilize at the cuboid. Move this up and down. To stabilize and motion the cuboid, excuse me, just the motion of the cuboid, you got to stabilize the calcaneus. So you're going to grab onto it like this. Okay, have your patient roll away. Put your fingers like this and move it up and down. So your index finger goes on top, thumb goes on the bottom. Everybody got that? To motion palpate the calcaneus, you're going to have the patient sit upright, stabilize as much as you can into the talus, and you're going to do this figure 8 type motion. Okay? Okay, wherever the bone is, the restriction is going to go from the line, point of misalignment to the point of correction. Okay? When you're motioning the distal metatarsal heads, you're just going to push them up like this. Individually, just pushing them up. Okay? And remember, always do the good side. I don't think there's any more bones, are there? That we've worked on anyway. I know there's more bones. But okay, if you're going to adjust the talus, thank you. You can have the patient with their foot just barely hanging off the table, or you can rest them like this, is fine. You're going to make your adjustment through your chiropractic index finger way up on the talus. You don't want to move down at all where you're on the navicular or the cuboid, way up on the talus. You're going to put the patient's foot into dorsiflexion, traction, and thrust with the scoop. Okay, if it's gone lateral, you're going to use a little bit of eversion when you're doing this, and you're going to change your line of drive, thrusting it this way. If it's gone medial, you're going to change your line of drive and thrust it this way. Okay? Everybody got that? We'll do posterior, and we do the posterior calcaneus. Okay, now, we're not going to have you do any of them, but any one of them that goes superior, you just grab it and yank it down. Okay? We're not going to do those. But, this is the one I want you to know for your navicular. You're going to come up under the navicular tubercle. It'll drop inferior and medial. You're going to come up underneath it with your thenar. Grab onto the foot this way, not like this. Grab it like this. Come up, open the joint, thrust it. The first cuneiform's the same thing. Right here, you're just going to open the joint a little differently, thrust it up. Okay? Okay. We'll do those ones. Prone. Let's see. Then the cuboid. You're going to come around to the side. You're going to wrap your fingers like this around the calcaneus. And with the same hand that you're wrapping around the calcaneus, you're going to come up underneath the cuboid, up underneath the volar surface of the foot. Take the foot with your hand this way, the dorsum of the foot with the palm of your hand, and you're going to put it into plantar flexion, or maybe even plantar flexion with some eversion. Thrust it out. Okay. If you're doing the distal metatarsal head, you're going to grab onto it, you're going to traction it, and you're going to thrust it up, whichever one it is that needs to be adjusted. Okay? Everybody got those? Okay. If you're going to do the distal fifth metatarsal head, we'll use your left foot on this one. Bring your foot up here. The way I want you to do the distal fifth metatarsal head is this way, with your thenar on that. Grab the person's foot. Again, your foot, the palmar surface of your foot is going to be on the dorsum of the palmar surface of your hand is going to be on the dorsum of the foot. You're going to put it into dorsiflexion, and you're going to evert it and shove it. Once you get your liner dried, thrust it back down. Okay? Everybody see that?
Do it one more time.
Okay, make your contact here. Take the foot, dorsiflexion, eversion, and shove it down. Okay? Can we give him some head rest, please? Doesn't have to be funny. Promise. Can lay face down. Okay, a couple things we'll do from the back. When you're adjusting a posterior talus, you're going to want to adjust more on the medial malleolus side. And if you're not knowing these contact points and everything, please look at Charlie or have Dr. Powell or myself point them out to you. You're going to stabilize right up underneath the distal tib fib, and you're going to come in on the medial side. I suggest that you use this part of your hand right through here, stabilize here, and you're basically just going to shove it back forward. Okay? That's going to be very similar if you're adjusting a posterior calcaneus. You're going to stabilize. Move up just a little more for me. There you go. And you're going to come web contact right on the posterior part of the calcaneus, and you're going to drive it straight forward. If it's gone lateral, you drive it forward and torque it this way. If it's gone medial, you'll drive it forward and torque it this way. Okay? If you have an inferior first or second or third cuneiform, you can do it this way, particularly the second and the third. Make sure you have your contact, find your navicular tubercle, go right over top of that second or third, spread the metatarsals, and it's a thumb-on-thumb contact. Some people, like I said, like to use some plantar flexion. I like to keep it neutral. I think it works a lot better, and you thrust through it. Okay? Second or third works like that. The thing that we haven't done was the anterior, medial and anterior lateral calcaneus. So I'm going to have you sit back up. Okay. Turn this way, if you would. No. So if it's going anterior and medial, we're going to contact here with our thenar here. Get a good contact here. Stabilize as much as you can into the talus to try to hold it stable. And just thrust it back and with some torques. Because if it's come anterior and medial, the joint's open here. We've got to torque it back this way. And if it's this one here, we're going to send it back this way. Okay? Everybody got that?
Can you do that one more time?
Just like this, stabilize here, come in, and shove it back, and torque it this way. Okay, so it's like a supinating torque.
That's
If it's gone anterior lateral.
Okay.
Is that everything? So we learned a bunch, huh? So